All right, good morning. All right, so we just did a breast augmentation. Everything went terrific. I would like to tell you some post-op things to make things easier for you and what's going on, okay? First of all, you're going to be sore. Your breasts are not going to look perfect for a couple weeks. That's why I showed you the picture of the progression of the convexity in the top of your breast. It will eventually come down to being a natural look. It just takes a little time. We've had to cut the muscle because we put this implant below your muscle. And it takes time for everything to heal and recuperate. What I'm going to do today is I'm going to put a different kind of dressing on you, feel a lot more comfortable. So that will be pleasant versus this big wrapped up thing, okay? You can certainly shower, okay? You can take it off, you can shower. But typically what I like you to do is do you have a stool that you can sit in the shower?
We don't.
We could sit on the bench in the shower.
Do you have a bench?
Yeah, we do.
Okay, so here's what you do. You sit on your bench, make the water lukewarm, then stand up and keep it lukewarm and take your shower like that for the first 3 days, lukewarm showers. If you make them too hot, two things are going to happen. One is going to cause the blood vessels to vasodilate. And if the blood vessels in the healing area vasodilate, two things will probably happen. One, you'll get a little more swelling, be a little more hurtful, and you may pop a little blood vessel that is now shut down by platelets, and it takes about 10 to 14 days for those platelets to be replaced by regular collagen. Okay? And so that's where that is, okay? The other thing, if it gets too hot and you're in the shower, you get a little lighthead, you'll fall.
Right.
So if you're kind of close to, temperature of the room, this is probably about 70, 72. Your body temperature is like 98.6. So you probably can handle your temperature, but just make sure lukewarm. Think about what I tell people. You had a baby once?
Yeah.
Remember you put your elbow in to see how warm the water was before you let the baby? That's about how I would like you to shower for the first 2-3 days. Now, certainly after that, you're feeling really good. Don't start off sitting in the stool. Stand up and take a shower like any other day. So that's the shower. Okay. After the shower, you don't have to put any ointment over the incisions because there's a plastic dressing on them. You put the little, it's a surgical wrap. Okay. It's like a little binder type of thing. Okay. It's a small lace wrap with a Velcro on it. Okay. And I need you to start doing some exercises. I have found the gals that massage and exercise will do better than the women that don't. Somehow, some shape, some form is a little mini yoga session for your pectoralis muscles, and it seems to help the patients get better quicker. Okay, I'll go over those instructions with you. Basically, just briefly, it's like doing the backstroke. Okay, like that, because you can see you're gonna stretch this.
Right. Yeah, this one is harder to
Yeah,
do.
but it's all you right after surgery, so I don't expect a whole lot in the next 48 hours. But I do think by 5 days you'll be able to do it. So backstroke's important. The itsy bitsy spider you're standing against the wall, and I'll show you how to move your hand up like that to do it. That's the second thing. The third thing is, did you grow up in Florida or in the north?
More.
Oh, good. So you know what a snow angel is.
Yeah.
So lie in your bed and do snow angels, because when you do that, you stay in the correct plane, and now you're just gently isometrically stretching the muscles. Okay? And that's what you're going to do. The next time I see you back here, I'll show you what kind of exercise I want you to do to massage your breasts better. But right now, your breasts are still a little bit too tender,
Right.
still a little bit too tense, that I think you're going to be comfortable doing the massage. I'd like to see you the early part of next week, and we'll go over what the massaging is. Okay? But those are the things that I think are the most important things. Now, in terms of food, have you taken much of the pain medication I gave you?
Yeah.
Okay. So
I had to, like, every 6 hours.
okay, just be aware the side effect of that pain medication gets you a little constipated, and it can make you nauseated. So I'm not sure how much food you're eating, but make sure you eat drink a lot of liquids. Okay. And if you haven't started a regular diet yet, start with soft things like yogurt.
Yeah, I just had a little yogurt as well.
Okay, good. So you have some yogurt, some cottage cheese, usually the ladies like. Ice cream is fine. You can have ice cream. Okay. Jello, applesauce is great. By tomorrow, I want you to do real food. You shouldn't be having that much discomfort with the pain, so have that, okay? And one of the things you may want to buy is get some Colace, which is a stool softener.
Oh, we bought Docalac.
Same thing, same concept, okay? The whole idea is because the Percocet that I gave you, the pain medicine, kind of slows all your processes down, and it may get a little difficult to move your bowels a little bit, so it's probably a good idea to try that. Okay, so I'm going to put up the little wrap on you, and I'll show you the exercises. and I'll see you the early part of next week, okay?